um, proactive target. Before setting proactive target, there are two main things must be finished earlier. First, manager training must be completed. A number of risk assessment also should be conducted, so that benchmarking can take place. When we say benchmark, it means where performance can be compared against other company in the same industry. This is benchmarking. It can be, the benchmarking, it can be set alongside with the aim and objective of the organizations, so that the policy will be heading in the right direction. And all organization objective should be smarter, of course. In the strategic theory, strategic management, the objective must be smart. In benchmarking, the objective must be smarter. And smarter, it means that S is specific. The objective must be specific. Who will do and what and when? Who will do the actions? When the actions will be done? And what is the type of actions can be done? This is specific. And measurable, which means the target must be measurable. If you cannot measure it, you will not manage it. Also, it means accountable. The person responsible for implementing the target should be clearly defined. This is accountable. R from reasonable. Reasonable, it means the target should practical or should be practical. For example, will it work? Can it be implemented? Time, or T from timely. The due date of the actions must be timely, connected with a specific time. It cannot be in open times. There may be an interim action that can be implemented sooner if required. E, effective. The actions must be effective. And R, reviewable. Reviewable. It means it must be reviewed by. Or will these actions cause any problem? What might be negative impact, if any? This is smarter, specific, measurable, accountable, reasonable, effective, reviewable. From here, we go ahead to benchmarking. Benchmarking indicators of success should be set. However, it may be necessary to set benchmark alongside the aims and objectives to ensure that the policy is on the track and heading in the right direction. Some companies choose to measure the performance of their policy against the performance of similar company. but within the same industry. In benchmarking, it must be in the same industry. Education and training industry cannot be compared to manufacturing of any other type. Also, in benchmarking, we have to define the safety rules and responsibility of the individual, and this should be include allocations of responsibilities, line of communications, how people can be communicated, feedback of loops, role of managers influencing health and safety policy and monitoring effectiveness, directors and senior management who will be responsible for setting the policy, objective, and target, supervisors who line managers will be responsible for checking the policy is being complied with or on daily basis, health and safety advisors who can advise on accidents, investigation, and on compliance issues. Also, the specialists such as nurses, electricians, technicians, who will give advice on their particular specific health and safety issues. Health and safety representative, who will represent the employees during consultations with the employer regarding to health and safety issues. Fire marshals, who will be responsible for evacuation during an emergency. Also, first aid, who will be responsible for carrying out first aid to injured person. All these roles and responsibilities should be defined to the individual earlier. There are many specifying arrangements for achieving general specific goals, such as communications, media, competency, hazard reporting, monitoring compliance, allocations of finance for health and safety issues, organizing, planning, control hazard and risk assessment. Further, specific arrangements as working at height or fire, electricity. Also contractors, how would you manage your contractors and visitors? Manual handling, maintenance issue, transport, other substance and stress. All such issues must be specific, or it needs a specific arrangement. When we have finished that, we need to see or review the policy, or is there any circumstances require policy to be reviewed? Yes, circumstances requiring the policy to be reviewed are when changes in structures of the organizations, or after introductions of new or changed the process of work methods, or after changes key personnel, or changing in the premises if you have shifted to other new premises. If you make a new innovation in the premises, you need to change your OSH policy, not to change or review it or to modify it. Also, flowing enforcement actions, adding to or as a result of consultations with the workforce. When you consult your employees, they know the details, the components, the small issues. They may advise you or give you an advice to change something in the policy. It should be taken into consideration also. Or after sufficient time, it might be the time is over, or your policy is out of date. As we see, we seen as today at the COVID-19 period, everything has been changed. Lifestyle changed, offices changed, the place of work changed, everything has been changed. So accordingly, we changing, reviewing of our policy. ILO recommendation on occupational safety health, principle and objective. ILO recommendation or recommended that health and safety policy should be include the following principle and objective. 1. Protections of health and safety of all members of the organization by prevention of related injuries, ill health, diseases, and incidents. Complying with relevant national laws and regulation. Consult with the workers and their representative in all safety management system. Have a continual improvement and management system performance.